and get started. Can you all see my screen? Okay. So for today's agenda, I wanted to go over a few more details that we had to share about the June collaborative-wide meeting and some of the initial thoughts that we had for that. Talk with you about some CGM policy updates, both from Medicare and Medicaid, that we wanted to share with you all. And I want to talk with you about communication preferences, specifically how we may want to tap more into the practice liaison role that we've had designated in the collaborative and how we might be able to better leverage that. And then just go over some general updates and reminders of things that are coming up in the next little bit. So our collaborative meeting, as you should all know and have hold on your calendar for, is going to be taking place on June 16th. The MCT2D portion will be taking place from 8 a.m. to noon. Much like these calls, we're going to be doing it jointly with Inhale. So following our portion will be a lunch from 12 to 1. And then any POs that are also participating in Inhale will stay on for the afternoon sessions. Any that are only in MCT2D will be done for the day after lunch. We're going to be hosting it at Lansing Community College West Campus, and we decided to do this based on the feedback that you've given the Blue Cross Blue Shield teams on the PO CQI focus group that they host, that Lansing would be a good location that's central and that would be preferred. So we'll be having it there. We're going to open up registration for the first week of April, and like last year, we would ask that the administrative lead or another primary contact at the PO and the clinical champion attend. But unlike the regional meetings, we can accommodate a lot more attendance at this, so we're not going to limit the number of people per PO. And if anyone from your practices or the clinical champions want to attend as well, they are welcome to do so. What we're thinking as having been the primary focus of the June collaborative-wide meeting is around CGMs. So we just started planning the content for this earlier this week. So we're in the early phases of figuring this all out. But tentatively, we want to have a keynote speaker on a topic related to CGMs, someone who's doing something innovative in the field that they could share with you and that we can learn from. We're gonna then work on pulling together a panel of the PO participants talking about CGMs. On the next slide, I have a couple examples of some questions we might ask that panel, and then we'll put out a more official request for you guys to volunteer to be a part of it in the next little bit as well. Following that, we would hope to have a CGM focused breakout session where we'll have a guided discussion amongst the attendees as well about how they're operationalizing CGMs. And then a little break from the CGM focused content, we were going to plan to have a presentation from the Social Determinants of Health CQI that's called MShield on resources and opportunities for addressing SDOH needs, as well as provide you a little bit more details on MCT2D's focus on health equity and how we're planning to build this into the work that we're doing as well. So we on our end are working on our health equity statement and goals at the moment, and we'll have that ready to share at the June meeting. So that will be the one departure from specific CGM focus, but we think it'll be interesting for you and hopefully make you aware of some more resources and ways that these can be addressed through working with these different community resource hubs that MShield has connections with. And so for the CGM panel, when we reach out about that, we'll be looking for approximately 4 or 5 PO representatives to be a part of this. It'll count towards that PO level learning community requirement. And as we're getting to the end of tracking for this current VBR year, if you've already met the PO level learning community requirement from this September to August timeframe, we'll also let it count towards your future one. So we're not really going to limit it and not give credit to those who have already earned it, as we're getting to the point where a lot of you have through having your endocrinologist present at the regional meetings in the fall or being on the PGIP quarterly panel or these other opportunities. So we wanted to broaden that a little bit more so it can count towards your future one. And then we'll be asking things like, has your PO done anything to help practices more effectively incorporate CGMs into patient care? Have you worked with any outside sources like vendors or device companies in ways that have helped with CGM implementation in practices? Do any central staff at the PO support use of CGMs in the practice? If so, how? does the PO offer guidance or support to practices on identifying patients who may qualify? So we'll likely add a couple more questions as well, but just to give you a high level overview of the kind of things that we would be asking the panel to answer. And now I wanted to get your feedback on something. So I strongly invite you to share your thoughts in the chat or to unmute and speak up as well. One of the things that we were considering, because we're going to be focusing on CGMs, we thought that maybe it would be useful for you to invite like representatives from Abbott and Dexcom to the meetings, not to speak and not to like seek you out, but they would have a table where if you had questions or if you wanted to talk with them about something, you could approach them. So it would be completely up to you as like an individual on if you want to interface with the device companies at all. But we didn't want to just decide to do it or not do it. We wanted to ask you, do you want that? So please give me some feedback on what you're thinking. If this would be in any way useful to you or your PO, and we should invite them, just put yes in the chat. And if it's not something that you think would be helpful, you don't really know what you'd talk with them about, you're not sure if it would be useful to have them there, we will. Okay, amazing. Thank you for the input. All right, well, a few responses are mostly yeses, so this is really good to know. We wouldn't want to do this if it was something that wasn't. So based on this, and we'll ask at the PO call on Monday as well, but we'll reach out to like their representatives that we know there and invite them to be a part of that. Okay, perfect. Yeah, amazing. Thank you all. This is really, really helpful. So we'll make sure that they are there. Okay. Wanted to share with you a couple CGM coverage updates now. Before I move on, any questions at all about the collaborative wide meeting? Okay, great. So we have good news on both fronts for Medicaid and for Medicare around changes to CGM policy. So as you all are aware from the regional meetings, we've been having these conversations in partnership like with the American Diabetes Association and on our own with Medicaid about their coverage for CGMs for type 2 diabetes. And where this stood previously is theoretically CGMs were covered for type 2 diabetes patients with prior authorization, but we were never able to get clear criteria on what that prior authorization requirements were. Like we weren't able to be told like they need to be on insulin 3 times a day. We just did not know. It was just basically yes with prior authorization, but the criteria were not evident in any way. Now, Michigan Medicaid just put out a policy. It's linked here. So when we post these slides, you'll be able to click this link and it'll take you to it. CGMs are covered for type 2 diabetes with prior authorization, and the requirements are specifically listed out such that now we have an idea of what's going to be covered, because like I said before, we didn't know what was, what wasn't, what got approved, what didn't. It was very mysterious. So now the criteria is that the beneficiary is under the care of an endocrinologist, a physician, or a non-physician practitioner, like a nurse, a PA, a clinical nurse specialist who's managing their type 2 diabetes. The provider must document that they completed a DSME training within a year. They have to be on insulin, but there is not a specified amount of insulin required. So it's not like the 3 times a day that some insurance policies have. They do have to have blood glucose testing 2 times or more per day, and then be educated on the use of the device and willing and able to use CGMs. And like I said, it will be under like a prior authorization. I would definitely still see this as a step forward where the criteria is outlined, and I think the insulin requirement of not having it be a specific number of times a day is a good win. That said, this policy is open for comments until March 30th. So we at MCT2D are going to be responding as an organization with our comments and requested changes to the policy. Like, for example, we're going to ask if someone's on insulin, if the prior authorization can be waived. That's one of the things that we'll be submitting during like the comment period. We'll also send out a link to the policy and these details that I just went over to like your practices. So, you know, the more input they get, I'm sure the more any comments impactful to them, the more people who are saying it. So if you and your practices want to reach out and share your thoughts about the policy and things that you would request changing about it, I would highly encourage you to do so. The directions that are given on the policy is just that comments should be emailed to Lisa Trumbull. I listed her address there as well. And like I said, we'll be sending an email out to you and to the Practice Clinical Champions as well that sends the exact link to the policy and gives you the information you would need to make any comments. So in another positive policy change, Medicare has also updated their policy. Previously, they required 3 times a day or more insulin, and now it's been changed to just insulin use at all without a required number of times per day. Theoretically, according to just some of the articles that we read about it, that would double the number of patients that would qualify for a CGM under this policy change, since most people are using it once daily as opposed to being like more intensive insulin users. It also allows for CGMs for patients who don't use insulin at all, but have a history of hypoglycemia. So recurrent level 2 events or 1 level 3 event. And this policy is going to go into effect on April 16th. So also just easing up the requirements there. So we were happy to see both of these. The Medicaid is definitely a step forward from where things were, and hopefully through this comment period and process, maybe we can get it even a little closer to what we would like to see. Any questions at all before we move on? No? Okay, great. So just some general updates and reminders. The regional reading registration is due this Friday. Anyone who has not yet registered, we'll send out a reminder to them on Thursday, May 9th as well. The coverage survey that's sent in tandem with like the regional meeting registration is also going to be due on March 10th as well. So they'll get that same reminder. Well, there's a different reminder. There's a registration reminder and a coverage survey reminder. Both will go out on Thursday to anyone who hasn't completed them. And as a reminder, your nephrologists and endocrinologists are going to be expected to attend the spring regional meetings, but not the fall regional meetings. They'll receive these reminders too, and you should also be able to see on your VBR metrics page who is registered and who isn't registered, so that you can ensure that your practice's requirements are being met as well. Other pending VBR metrics and things that are due upcoming or before the end of the VBR year. So the best practices submission form, we sent that out initially on February 7th. It's due on May 1st. We'll be sending out reminders only to people who have not yet submitted to the clinical champions on April 3rd and April 17th. And we'll send reminders to you at the POs on the 10th, 24th, and 27th. Try to stagger it to give them time to complete it in between then, so they're not hearing from us and then hearing from you about not having completed it as well. I won't go over like all of the details of what this all includes, since we went over it at the last meeting, and it'll be in the slides if you want to read it as well. But just wanted to call your attention to this. And then for any cohort 2 practices, we have the case summaries that are all going to be due on June 1st. So as a reminder, we changed this based on your feedback of how challenging it was to get every physician to do 3 of these. We pivoted to doing them per practice in year 2 and not per physician. We're asking for 3 case summaries by practice, one on CGM, 1 on low carb diet, 1 on the medications. And I have the same reminder schedule set up here too. We're doing them a little more frequently since there's the 3 that they have to get done. They'll get a separate reminder for each one that's still pending. And here's the update schedule for when we can expect those to go out and to let you know who still has to complete this. So with that said, going over like this information and like who these reminders are being sent to. So as you can see, we reach out to you, we reach out to the clinical champions about these things that need to be done by the practices. But we haven't really used this practice liaison role that we've designated within MCT2D very much for communications. Like we have on this slide, this role was requested by Blue Cross Blue Shield primarily for you as the POs to have like a designated contact at each site. They were picturing it like if there were data related questions or things like that. So we designated this role early on. We require that each of your sites have one, but we haven't really been reaching out to them extensively for any collaborative communications. But it was brought to our attention that some of these requests, like for example, the coverage survey, which is a little bit more administrative of data than directly clinical that we were asking for, maybe better shared like with the practice liaisons. And I'm guessing, though I don't know, and feel free to correct me in the chat if I'm wrong, but I'm guessing who you primarily have designated for this role are people like office managers or more that type of role in the practices, a little bit more removed from like the clinical space. So we wanted to ask you how we can best use this role and reach out to them and communicate with them in a way that supports you and supports your practices. Because like we said, we've been reaching out to the clinical champions for the most part. I know a lot of them are very busy and are in clinic and aren't necessarily on email, or are, when they're checking it, they have other emails for the whole day because they've been in clinic all day and things might get missed. Do you want us to reach out to the practice liaisons and include them more frequently, either like in tandem with the clinical champions always, or do you want it more targeted on specific things like VBR deadlines, the same way we like reach out to you, or sending opportunities like learning community events? So my question is, would you like us to reach out to this role more? And do you have any particular thoughts on how we can best use them to support the work that we're doing and making sure that things get completed? Yes, on all emails. Okay. And so I think I was just at a meeting right before this, and we were talking about the poster contest that we are doing and that we announced to you and sent out a reminder about earlier this week. We plan on printing those off and bringing them to the regional meetings so that your practices can have them and take them and put them back up in their clinics. We were talking that might be a great initial communication to this practice liaison role about like the size of the poster. Honestly, as simple as that. We didn't want to make a unilateral decision from our end on like what your practices may want. And that seems like a kind of perfect intro email. I'm happy to write something up that not only lets them answer that question so that we can decide what size posters to order, but also let them know, hey, we're going to be copying you on more things in the collaborative going forward. We're going to always send things to you and to your clinical champion so that you like both have the status of these different things so that you can help make sure everything gets done. So if you disagree with this, last chance to make your statement on the reasons why we shouldn't do it. If not, we'll move forward with including them on more communications. Okay, great. Just a few other small updates. So we'd mentioned that we're going to be presenting at the March PGIP quarterly meeting. Blue Cross Blue Shield asked us to present, and we'll be hosting a panel with PO participants. We're going to start with like a 10 to 15 minute overview of MCT2D, and then the following PO representatives are going to be on our panel. So Maureen went, Erica Perpich, Dr. Coleman, and Laura Peterson. We're really, really grateful for you being a part of that, and we're excited to have this discussion with you. We're going to record it for anyone who doesn't attend PGIP quarterly and may be interested in watching it, or if anyone from your practices wants to watch it. And these are the questions we'll be asking, so you can kind of see. I won't go through all of these again. They'll be on the slides when we send them out, but you can see if it would be something of interest to you to view later. But we'll make sure that it's recorded so that you can review it. And yeah, we're very, very grateful for those who volunteered to be a part of this, and we're looking forward to the panel. And definitely come say hi to us at PGIP quarterly if you see us. A few other updates. These are the learning community events now that we're kind of shifting to the second quarter and what you can expect and what's coming up. The one we had last Friday on primary or provider delivered care management codes was very, very well attended. There was a lot of questions. It was really great. I hope it was helpful to everyone who attended. I think there was really good information shared there. We were able to get a lot of questions answered. For the ones that are upcoming later this month, and we mentioned this last time, but we're going to have Rena actually present now, our dietitian, on different, like more specific low carbohydrate diet requests. So as you know, these topics that we're covering, they all came up via the input that we received from your clinical champions at the regional meetings. And there was specific like low carb diet topics that people wanted to hear about that we think we can wrap up all in one presentation, like around meal planning for like different cultural eating patterns and devising recipes and things like that. So Rena will be presenting there. On May 22nd, we're having Dr. Sukal, a cardiologist, present about MCGTD or type 2 diabetes and cardiology. I think that'll be really exciting. We've been getting requests for a cardiologist to speak, I think, since like our first regional meetings a year ago. So I'm really glad we're able to meet that. And I think it'll be an interesting discussion. And then we'll be doing another panel discussion in April around implementation of the initiatives. And we'll reach out to your practices in April to see who wants to and is interested in participating. And hopefully, having just done that best practices submission VBR requirement, like I think it'll be a perfect opportunity to discuss like the topics that they submitted there and what they were doing. So we might even identify people to directly reach out to based on the submissions that we have there and what we found. And down here, there's a link to register for all of them. We have them throughout the entire year. I just wanted to focus on the few that are upcoming. A few data updates. So we've received an extract of the data that's used to create the patient data dashboards. So we're going to be using this data and receiving it from the Michigan Data Collaborative on a regular basis. We're going to use it to be reporting out metrics at like the regional and collaborative meetings, tracking progress on future like VBR metrics, and then establishing push reports of data to you as the POs. So to go into that, one thing that we want to start providing for you in the near-term future is like data push reporting. So instead of you going into the dashboards and downloading it or looking into certain things, we wanted to have some like nice high-level reports of where your practices are compared to the collaborative, compared to the region that we send out to you on some sort of regular basis. We're thinking quarterly at this time, but we'll also, as we get closer to being ready to do that, make sure that we bring it to one of these PO monthly calls, maybe when we have a mock-up of it, and learn like what would be the most useful information for you to receive and what would be actionable for you and who you directly want it sent to and things like that as well. So hopefully that'll just give you an additional way to take in this data without having to go out to the dashboards, and it'll be useful for you. And then the final thing I wanted to let you know about, so the next year of specialist VBR went into effect on March 1st, and that goes until February 28th. On your VBR metrics tab on the administrative portal, you should see now your endocrinology and nephrology updated tables. So this is just an example one of nephrology practices who are going into their second year. So like I was mentioning too, this is where you can see who's registered for the regional meetings or not. Any that are NA are just not available yet because they haven't happened. They'll switch over once we do have those happen. And you should be able to see all that there and let us know if you have any questions about it when you take a look at that. And that is all that we had. As a reminder, we're not going to be hosting the PO calls in April because we'll be having the regional meetings. So the next ones will be in May on either Monday, May 8th or Wednesday, May 10th. Is there anything else anyone would like to discuss or go over before we hand it over to Inhale? No? All right. Well, thank you all so much. We really appreciate the input on both the device company presence at the regional meetings and communicating with the practice liaisons more. Thank you for sharing your thoughts on that. I'll hand it over to you, Sean. Thanks so much.
Thank you very much, Courtney. Or sorry, Jackie, we appreciate it. Just waiting to.
We'll give it a few minutes to let people kind of change over and let people drop off. We're going to get started in a couple minutes. Just as a reminder, we're going to be moving into the inhale portion of the call. So you do not have to stay on if you are not in the inhale CQI. All right, I'm recognizing most of the names that are here, so we'll go ahead and get started. If we have any late joiners, they'll just miss our introduction slide that we show just about every time. I'm going to go ahead and share my screen. We'll make sure that these slides are available at the end of the call along with the recording. Can I get a quick nod from you, Sean, if you can see what you're supposed to see? All right, thank you. Same agenda that we usually try and stay with. We have some announcements and updates. We'll talk a little bit about our measures, in this case, specifically our tobacco cessation measure. We have some great updates with our portals and websites. We'll talk briefly about recruitment and then our upcoming events and important dates. Our announcements and updates. First and foremost, March appears to be the month that everybody takes their spring break. So you may see more away messages from our staff than is typical. We have several people that are going to be gone for a week or 2 weeks even at a time. We will continue to monitor all of our shared inboxes and continue to reply as soon as we're able, but we just wanted you to know that it appears there's a lot of spring breaks in the month of March. Our tobacco cessation counseling measure has been approved. We'll talk about that more in just a minute. And those resources will also be available online now that our website is up. The monthly newsletter went out on the last day of the month, so the end of February. We will be adding them to the website, so you'll have access to them as needed. And then as we stated in that newsletter, we're going to be building resource packages for the practices, and we're going to have a sign up for that. So we'll come back to that as well. I'd like to go over the tobacco cessation details here in just a second, but I did want to say that one of our sort of requirements for moving forward with tobacco cessation counseling VBR was that we needed to be able to include all of our POs, including those who only recruited specialists this time around. As you know, specialist attribution has sort of been the holdup there. And so we've gotten the okay to move ahead with our solution for specialist attribution, and we'll be making that our first priority. So when we do start measuring VBR for tobacco cessation counseling, should you choose to participate in that, that is available to specialists as well. The document that went around for the tobacco cessation counseling has all of the information in it for how we are scoring that and the population that we've agreed upon for the VBR. If you did not get this or you need it, it's available on our website, which I will show you in just a moment. But this is an optional 2% VBR for utilizing the tobacco cessation counseling CPT codes. Again, this is all claims-based. We're not actually asking you to submit any surveys or anything for this. And this is a PO level measure. So combining patients attributed to both primary care physicians and specialty care physicians. If we need to get into the weeds a little bit about how we're making those attributions, we can do that, or we can set up a separate call to walk through those. But this document should have been submitted or gone around with our newsletter for everyone to review. In addition, we have the second page here with the VBR details. The 2 specific CPT codes are listed here, which is kind of a intermediate counseling and an intensive counseling based on the time spent. And we also will be working with HBOM to provide several of the resources on their website through ours as well. So we're very happy that this was approved. We're very happy that we're going to be able to provide a VBR for specialists. And again, that approval was predicated on the fact that we would have a way to attribute patients to specialists within our dashboard. So in the upcoming months, watch for changes in the dashboard that will allow our specialty practices to start seeing information as well. And this was what the newsletter looked like in case anybody did not receive it. And this was on the third page. There was kind of a tobacco cessation details and resources section, how to bill and how to document for that counseling. And this link below actually brings you to those measure details. If you're not receiving this newsletter and you want to be, just let me know and we'll make sure that it's coming out. The portals and websites. So the Inhale website is live, inhalecqi.org. You can go to the website and get more information about our various initiatives and measures. I think possibly one of the most helpful things here is when you go to this measures section, you'll see the various measures that we are working on. And anytime that you go into those measures, there are resources specific to those right within the page. All of these are actually under this resources tab as well, but this is a nice way to get them sort of filtered out for use with the individual measures. A link to the HBOM website is here so that you can utilize their resources as well. And this is the tobacco cessation VBR toolkit that they produced for this VBR. So we're including that on our website as well. So we're very excited that this is available now. We encourage you to look around and explore things. This is a work in progress, as most websites are, so I would expect the number of resources on here to grow exponentially and for there to be a lot more documents for you to utilize within practices and for patient education. So website is live. Encourage you to take a look at it. We'll be adding more to it as we go. And as we have news, we will put news up here. Our newsletters will be here. Any of our past meetings, similar to MCT2D, will also be in here so that you can go and get the recordings for these meetings. As a reminder, you will need to fast forward through MCT2D if you don't need that stuff. So very excited about that. No administrative portal updates today, and the Inhale Learning platform is launched and ready to go. We've been circulating some QR codes so that we can get information to load people into the system. So we will review those spreadsheets as we get them and upload people. A couple of caveats with that. We have like a 24 or 48 hour expiry on the email. We've been unable to change that. So we'll try and communicate immediately after adding people to the system so that they know. Kathy, I see a question from you about login information. Where specifically do you need to log into?
So I just went to the Inhale website and it says, it came up like a sign in.
I will look into that. There should be no login information, so I'm not sure why it's doing that.
Okay.
It was just inhalecqi.org?
Yes. And then I clicked on measures. Oh, well, maybe not. No, it's not doing it. Let's see if I click on something else.
Nope. I know that is a common problem because we had a staging website and not all of the links transferred over to the live website. So I'll double check that. I'm not surprised it's happening and I'll find the link that's causing that. Most of them should get you where you're going, but there should be no login for the website.
Okay, super.
And Mary, we will resend the February newsletter. We are also, speaking of firewalls, we're also noticing that things that are coming out from DPRO, which is the vendor for our Inhale learning platform, are getting stuck in trash for just about everybody, including us. So if you sign up for that, or we send you an email to look for it, we will send a little reminder to check your trash, because everything, I don't know if there was some kind of update lately to everybody's system, but I feel like everything for us has been going into trash. And the other thing is there was an erroneous sending of login information from the vendor itself, and we tried to get out in front of that. So We will make sure that we are kind of rolling this out one location at a time if needed to. We can work with you to do lists that you would like uploaded into the system. There's multiple ways that we can get people going here. So if you want to work out sort of an onboarding plan for this platform individually, we're happy to work with you on that too. There's been some constraints with this uploading of people that has been sort of challenging for us as well. So we're happy to work with people on here. So we'll make sure that this QR code, this announcement comes out through you. And like I said, we want people to actually be using these. So if you have people who are interested, we'll work with them to get onboarded onto this system. There's going to be a walkthrough video that will become available. So anybody using the system for the first time will have some instructions as well. The next recruitment period for PCPs and pediatricians is coming up. The deadline for identifying them will be June 1st, and that will be a September 1st VBR start. We're going to send around official messaging this month for anyone interested in recruiting new practices. We're happy to have any of the practices that are interested join at this point. Again, if you do have specialists that are interested, we're happy to write their name down, knowing we can't actually submit them to Blue Cross until approximately December. But right now, if you would like to do some recruitment of practices, we're going to have some updated information coming out about practice level requirements and what we're hoping for communication from practices and things like that. So we'll be formulating all of that this month and getting some messaging out to you so that you can do some recruitment if you're interested. So there's a question in the chat about a minimum number of patients with asthma or COPD to participate. This is one of those questions that we keep going back and forth on. When we originally recruited, no, there was no minimum. And then Blue Cross Blue Shield came back to us and said, yes, there's a 50-person minimum. This is one of our outstanding questions to Blue Cross right now is there really a minimum or is there not? Because if that's the case, a lot of the practices that are currently enrolled wouldn't actually be eligible. So if we have our way with things, we will endeavor to not have a minimum number of patients as long as people are receiving benefit from participating in Inhale. And we should have final word on that after this week. We meet with Blue Cross on Friday, and that's one of the things we'll be bringing up. So stay tuned. We hope there is no minimum, but it really depends on what Blue Cross Blue Shield wants. And if there is, I think 50 is a little high. Like I said, if we actually applied that to most of the practices at the PCP level participating now, they wouldn't be eligible. So we're going to try and find something that makes sure the largest number of people who want to be involved can without penalty. So thank you for that reminder. We will make sure that that's something we communicate when the recruitment information comes out. Upcoming events and important dates. Again, we are going to be doing the collaborative wide with MCT2D in June. The registration for that will be going out on their per their timetable, so probably end of this month. We have regional meetings that will start in the fall. We don't have any dates set yet, but we anticipate setting those soon so people can plan. We're going to do a combination of things, both kind of early meetings and after work meetings. And we're going to try and offer a couple of different options to people depending on what region they're in. The call dates for this month are today and the 13th. MCT2D is not having meetings in April. We are having meetings in April. So we will send out a reminder about that please do log in for a meeting in April with Inhale. They will be canceling theirs because of regionals, but ours will still take place. So we'll make sure that that goes out and that it's clear for everybody. It probably won't take up the full hour, so I would plan on about half an hour, but we will be using those April time slots. Going forward, as we start to have more content in our meetings, we're going to be looking for a time to eventually kind of break away and have a separate Inhale meeting. I don't think we're there yet from a timing perspective. We still don't have enough stuff to fill, but my guess would be as we come into the next year, we may have a separate meeting. So we'll start planning on that and working with everybody to find an accommodating time or to offer enough options so that people are able to go. The last couple of things we put in here for question discussion. The first one is the Inhale Learning Platform. Obviously, the very first module that we put out was around inhaler education. We're starting to explore the next topics for what we want to provide both CME credit for and just additional education on. And so I wanted to see either feel free to speak up or put in the chat if there's specific areas that you'd like to see additional information on. Right now, the one area that we've really gotten some feedback is spirometry, appropriate use, appropriate technique. So spirometry was one of the big topics, but we are really open to anything, and we want to make sure that we're providing a valuable resource. So we really want to have you and your practices and the feedback there drive the decision as to where we go next. We hope to have lots at the end, but in order of operation, which is the next kind of big idea that you'd like us to tackle. If anybody has any feedback, we'd love to hear it. I see an agreement with spirometry. Spirometry is also nice. It kind of encompasses both asthma and COPD. We do have a few things that could be specific to one or the other, namely pulmonary rehab was one that somebody else brought up that's predominantly used for COPD. We've had some specifics for asthma-related medications like smart therapy, but we'd really love to hear from you on that. I believe in the newsletter, let me double check. In the newsletter, there was actually a little feedback section here with a QR code to join a survey and give some feedback there. Happy to report, based on our next question here, Dr. Lugogo is on the call. Dr. Lugogo, there's a question. Is there a nationwide shortage of albuterol right now? Have you heard anything about that?
No, I haven't heard anything about that. I know there's an issue with the Duoneb, but I have not heard anything about a shortage with albuterol. I really haven't. Now, there are multiple kinds of albuterol also, so it may pertain to one particular formulation, but I haven't seen or heard anything neither from patients nor from some of our partners. So I don't know of anything, but I could look into it if there's a specific formulation that they're concerned about. I could certainly look into it.
Thank you.
Mm-hmm.
The other question kind of available for discussion, if you have feedback, is specific resources that are needed right away. We have a tremendous number of resources that are currently available through the DPRO resource library. However, our plan is to make the free and available resource library on our website sort of be our source of truth and the place where we have all our resources. And so as we start to kind of stock that library, we'd love some feedback on what is urgently needed as far as patient-related resources, provider-related resources. So if you have feedback there, we would really value that as well in any specific area. So like I said, we hope to get it all there, but any urgent need would help us, pick a priority place to start. And with that being said, I'd like to kind of open things up for any other discussion or questions that people have, and what we can also be doing to support you right now. Again, March is going to be a little quiet, but we do plan on using this time to build the care packages as well to make available to practices. There's no questions or comments. We'll stay on for a few minutes in case there's any specific needs people have. Dr. Lugogo is here if there's any questions for her. I see a question in the chat. Do you have information on the advisory board? And yes, that will be coming out shortly. We've pivoted a little bit to start with our patient and provider or patient and caregiver advisory board, but we hope to have information coming out about advisory boards towards the end of this month. So stay tuned for that. Question in the chat. Our physicians want to know if there's any requirements due. At this time, the bulk of the requirement for participation with Inhale really comes down to our meetings. So at the PO level, the collaborative wide meeting is really our big required event for the year. At the practice level, the big required event will be the regional meetings that happen in the fall. They should know that as far as requirements, the education piece is not required right now, but in 2024, and as we enter our next round of recruiting and we update our participation requirements, the education piece or the module that's in there, or modules, will become required. So technically, no, there is nothing due at this moment for physicians. And if they'd like to stay ahead of things, the education piece will be required in the future, and then participation at those regional meetings is what we're looking to do. We would like to have a little bit more engagement with the practice level physicians. So we're going to be working on some communication strategy with them, which we'll work with obviously the POs on first before we carry that forward. But right now, what we've been tasked with is updating participation requirements for the following year. So we don't anticipate changing anything immediately, and we'll work with you as we get those. When will the data dashboard be ready after specialist attribution is settled? The data dashboard for specialists, I don't have a time on that yet. It is really dependent on how quickly MDC, the Michigan Data Collaborative, can build out our specialist attribution. And we are very hopeful that that is coming up within our next release is in April. So I don't think they're going to hit that one, but the first one in the summer. And MDC have data on the tobacco cessation measure, and yes. So the first priority is to make sure our specialist attribution is working properly and is attributing patients correctly. Right on the heels of that, we'll make sure that the tobacco cessation measure is being shown on the dashboard with appropriate attribution, and hopefully with an ability to generate a report that tells you how you're doing with regard to that measure. And we are right on the cusp of having our specialist attribution settled. So we've had several requests from Blue Cross to tweak little things here or there. And I think the goal is to make sure that they are working on that next. We have everything set for tobacco cessation. We just need to be able to attribute people to specialists. Good questions, everybody. I appreciate it. All right, we're happy to stay on a little bit longer. If there's more questions, we'll continue answering them. Otherwise, we will hopefully be in touch soon.
This is Susan at Great Lakes PO. Will you know if the advisory board, when those people are chosen, and are they going to be required to be at the next meeting?
So this is going to be any kind of advisory board that we have will be obviously on a voluntary basis. We'll ask for people who are interested in participating. And then as far as meetings go, our plan is to hold 2 meetings in person if possible in the year, 2 meetings virtually. With regard to the advisory board, we've chosen to dedicate time to our advisory board second, and our patient advisory board first. So if you have someone in mind who's very interested in being involved, we are offering people to join us at either the education working group or the QI and measures development group, where we really talk about what we're going to be doing from a QI perspective. So if you have someone, send them our way, and they're welcome to start participating as soon as they want. We're not going to be requiring any certain number of people from a PO to join the board, though.
Okay, I did send over Dr. McAvoy's information.
Okay.
So are there meetings he should be joining right now?
We can, I can reach out to him if it's okay with you and find
Sure.
out what his specific interest is, and then I can include him on any meetings he'd like to be on.
Wonderful. Can you copy me on that correspondence?
I will. Thank you.
And I had mentioned the meeting, that you're sharing with MCT2D, that is it's an optional meeting for the physicians.
It is.
But if you're going to have the people for the advisory board, if it's a requirement for them to be there.
No, not at this first upcoming meeting. Our hope is to have a community and patient advisory board meeting during that one. There will be time where we talk about the specific stuff going on within those working groups, but at this time, we are not planning to require any physicians at a board level to be there.
Okay. He was blocking out time, so he
Okay.
wanted to make
And I'll
sure.
double check with him too, to find out if he does want to come and participate in some of those things. We can let him know like what the agenda is looking like. So if
Okay.
he does decide to come, he can get to the important things on his interest list.
Great, thank you.
All right. Anything else I can help anyone with? All right. Have a great afternoon, everyone.
You also.
Thank you, everyone.